Welcome to Voices of the Community. I'm your host, George Koster.
And can I just make one comment too? So one of the things that has come out of the Society for the Neuroscience of Creativity was that, a few years ago we had our annual meeting and we had an NSF grant to bring in some educators to come and see, because we're like, look, we're doing all this great work in the lab about how to foster creativity. We want to get it out to the teachers so they can utilize it in the classroom. And we had a great time, lots of great conversations. And then at the happy hour, one of the educators came to us and said, look, this is all really great, but it's never going to happen. And we were just like, why? And he was like, because my parents and my community wants their kids to go to college. And until creativity is a prerequisite to get into college, we're not going to have the time or the funding to emphasize it the way we are all the other things that lead to better scores on the SAT. So you know what we did? We started working with college application essays, and we have a major project now across 8 different institutions, 42,000 college essays that we have run through our expert raters and a number of large language models to score them for their creativity. And it turns out that these creativity scores are almost as predictive of future GPA as the SAT, and they're 15 times less discriminatory than the SAT. And it gets better. This year is using that particular application model potentially, it still, doesn't leave this room.
We've got you. We'll hold them accountable.
To actually look at the next cohort. So now we can go back to the teachers and say, you know what? Actually, creativity is going to get your kids into college. We've solved that problem for you. Now put the music programs, put the creativity programs back into high school, because you can tell the parents solidly that that's what's going to get their kids into college.
Goodness, where to start? The U.S. healthcare system is a very broken system that is the system we have. And I think it is radical in and of itself to think that Medicare and Medicaid and United Healthcare and Kaiser Permanente will pay artists to be healers. But that is not enough. When designing, one thing that I would encourage people to consider if you're pursuing a arts on prescription program in your community is to broaden the definition of what is included in that network of arts and culture activities, both for the artists and healers in that community, and also for the patients or participants or members that would participate. Something that is so important to us at Art Pharmacy when we go to a new community and set up a program, we try to build as big and broad of a network as possible. But it would not be possible for us to know everything that was there or every need that an individual has. So as a patient engages with our care navigators and they say, well, I actually want to be able to go to the community center down the road. If that's not in our network, our work to do is to go bring that partner into our network and really meet that individual where they are. So yeah, I think that, building in the U.S. healthcare system is full of dilemmas and trade-offs, but surrounding advisory councils and programs with people who have lived experience in the design is essential.
Hi, my name is Eduardo Robles with Californians for the Arts and Voices of the Community here at the 2nd Annual California Arts and Culture Summit. We just got out of the Arts and Health panel, and I have one of our panelists, Dr. Tasha Golden. Hi, Tasha.
Hi, good to be here.
How are you doing? We just wanted to, just kind of get some key takeaways from the panel you just were a part of. And, before you kind of go into, some takeaways from the panelists, I really wanted you to kind of elaborate more on this vision of kind of redefining health in society.
Well, I think a lot of times people think about arts and health and they think about combining sectors. Like we're going to combine the arts sector with the health sector. And that is obviously a really great place to start. That's where we have to start now because those are the sectors that exist. But a larger way to think about it is to redefine health itself. So, I mentioned on the panel that the World Health Organization defines health as complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And if we actually carried that definition through, we would have to make sure that we're able to supply people with opportunities to be well. And it turns out, I get to ask people all over the world, what is well-being? And, the answers are really diverse, but they cohere around a number of things having meaning, having purpose, being connected with people, having supports when you need it, when things go wrong, being able to pursue curiosities, having a meaningful occupation of your time, a sense of contributing to something larger than yourself, being able to experience beauty and creativity. These are the kind of things that people say that well-being is. So if we decided as a culture, as a society, to embrace the actual definition of health, the real one that the WHO established in 1946, then we would have to think about how are we set up, whether that's, or whether we continue to call that our healthcare system or whether we just call it, our communities and our society. We would have to set up a way for people to find that meaning, to find that purpose, to connect with other people, to pursue things that are meaningful to them. All of those things that I just mentioned as far as definitions of well-being, we would have to figure out how to supply those. And those things, as it turns out, fall under the umbrella not of healthcare, but of arts and culture. And so the reason that definition matters for me is that instead of thinking about how do we, convince the healthcare sector that they need the arts or tie these two sectors together, it's more how do we redefine what health is so that it becomes incredibly apparent intuitively that these aspects of our community are aspects of our ability to thrive, and that thriving is an essential part of being healthy. It's not just a nice to have.
Thank you so much, Tasha, for taking the time to speak with us.
Yeah, thank you so much.
Today's episode was made possible through our co-production partnership with California for the Arts at their annual California Arts and Culture Summit. Special thanks to our technical crew, audio and video wizard Eric Estrada, and our co-production partner, Bayvac Media, and their wonderful team, and thanks to Casey Nance from Citron Studios for the graphics magic. A special thanks to our broadcast partners who help share these important conversations: KSFP, LPFM in San Francisco, KPCA, LPFM in Petaluma, Petaluma Community Public Access TV, Bayvac Media's SF Commons, and PEG Media's Public Access TV Exchange. I'm George Costa from San Francisco. On behalf of our team, thank you for joining us. Until next time, remember, your voice matters.